You are at the PCBH Special Interest Group meeting, and we're going to go ahead and get started in just a few minutes. Before we get started, I want to go through just a couple of housekeeping issues. If you'll remember from last time, in the control panel on the right-hand side of your screen, you'll be able to see a green button, green microphone at the very top of the screen. You can mute and unmute yourself. We ask that each of our attendees keep themselves on mute for the time being, unless you'd like to join the conversation, just so we can cut down on background noise and that type of thing. If you're having trouble hearing or other issues, go ahead and at the bottom of that control panel, you'll see a place where you can either ask questions or type in chat either to us as panelists only or to the full group. So feel free to use that, that methodology. And if no one else has questions, I'll turn it over to our PCBH chair, Jeff Ryder. Jeff?
Okay, thank you very much. And yes, it's just me today. Chris apparently thought he had something more important to do, so he might be joining us a little bit later. But I am going to just get the meeting started here. So first is just a reminder that we do have a listserv up and running, and I see things posted there every so often. But I want to just encourage people to use that whenever you have any kind of question or project that is PCBH related that you'd maybe like some input on. We'd love to have that become a robust listserv. So, and the email address that you can use to post things is listed here on the agenda. Now, our first item was actually a special item. We were planning on having Susan McDaniel. Oh, and it looks like she just joined us. Great. So, hello, welcome.
Thank you.
Perfect timing. Swooped right in here, right at the right moment. I was just starting to introduce you. So, yeah. So, as some of you saw probably in the emails that were going around, we have Dr. Susan McDaniel who is joining us, and we're going to take the first maybe 15 minutes or so here of our meeting to talk about her candidacy for President of the American Psychological Association. We know that not all of you probably on this in this SIG are members of APA, but many of you probably are, and even if you're not, it's hopefully something you're interested in. So, but she has long been a proponent of integrated primary care and behavioral health, and it's notable here that she's the only candidate for APA this year that has that kind of credential that's relevant to us. So we wanted to give her a chance to just talk to our listserv here a bit about why she's running for president, what she'd like to do, and as president if she's elected, and then open it up a bit for questions too from people on the call. So I think what we're going to do is we're going to have Dr. McDaniel just talk a little bit here first, and then we do have 3 prepared questions when she's done with her sort of more formal introduction there. We have 3 questions that I'll ask her that were submitted from our SIG membership, and then we'll open it up for whatever time we have remaining to talk about for people to just ask questions. So perhaps as we're going along, if you know you're going to have a question for Dr. McDaniel, you could type it in the chat box, and then you know, we could call on you or read the question later, or you can just unmute yourself when we get to that point and ask your question. Either way should probably work okay. And I do need to make a little disclaimer here that her presentation to the SIG does not mean that we are endorsing her candidacy as the SIG. In fact, we're not even able to really do that because it would probably be a conflict of interest since Dr. McDaniel is actually on the board of CFHA and a member of this SIG.
CFHA already endorsed me.
Oh, all right. Well, then it would be redundant then is the reason. Okay.
No, it would not be redundant. But anyway, anything else to say, Jeff?
Pardon?
Anything else you wanted to say? Or
I don't think so. So go ahead and launch right in.
Well, I wanted to thank you and also the SIG for allowing me some time to talk. I feel like I'm talking to my people, which is really nice. I also just wanted to say something to those of you who aren't psychologists that I hope maybe this discussion might encourage you to think about how to promote primary care and behavioral health consultation within your own discipline. CFHA is a wonderful organization. I've been in it since we started it way back when, and I really enjoy it. And it's also important that we promote this because the training tends to happen in accredited programs, and the guilds have a lot to say about that. So the reason that I'm running is because I think for a number of reasons. I've been in primary care since 1981. Probably some of you weren't born then. And I feel like it's so important right now that psychologists and other behavioral health professionals step up to the plate and contribute to healthcare reform. And I realize that because of my position and the different things that I do, that I know most of the people in the leadership of the primary care medical organizations, and that it would be a great opportunity to form some political alliances between APA, perhaps other mental health organizations, and primary care, because I think it's at the political and policy level that it's or more important to work at that level than working on the ground to develop the models that really take care of our patients. So I realize that it's something that I feel like I've been preparing to do for a long time, and it's the right time in my personal life and my career to contribute in this way. So that's the short answer.
Great.
What I want to do is obviously I want to promote primary care. I want to infuse primary care training into graduate level, not just internship and postdoc, although those are very important too, but from the beginning. I want it in the undergraduate classes. I want it in the high schools. So you take each part, education, science, we need funding, and we need our scientists to pay attention to really doing evaluation of various models of integrated care and just being able to show how much we offer in terms of quality of life and often cost savings as well. It's certainly in the public interest. I think patients, as you all know, 95, maybe 99% of them love it. And what am I leaving out? Patients, public interest, science, and education. I think that's all of it. So I feel like that I'm well positioned in terms of my relationships with other providers. I just came back from Society of Teachers of Family Medicine, and one of the really nice things that happened is a lot of physicians and non-psychologists wore my button, Susan McDaniel for APA president, and I love that. You know, I definitely am an interdisciplinary person. That's how I like to work. That's how I think it should be, and I think we all need to be strong within our own discipline and get good training, but then I think we contribute as part of a team. I wonder, would it be useful? I could just say a few minutes about my background since
Sure.
It's so long. So I came out of a clinical psychology program at UNC Chapel Hill. I did my internship at UTMB in Galveston and got turned on to family therapy there, and then went back and did a postdoc in Houston at the Texas Research Institute for Mental Sciences in family therapy. And then I moved to Rochester in 1980 because my then boyfriend promised if I would come up there, we would leave immediately upon him finishing his med-peds residency. That was in 1980, and I am sitting in Rochester today. But part of that is because while he was a resident, interacting with many of the people that are our faculty now, George Engel was on the faculty as well as Lyman Wen. So George Engel, who developed the biopsychosocial model, and Lyman Wen, who was one of the pioneering family therapists, and they became my primary mentors. And in a place that it was really very community-based, like the people in psychiatry were very community-oriented, the pediatricians were very, and they had leaders in the field. So it was just a fertile place for me to begin to want to apply family systems concepts to the biopsychosocial model. So I worked with Lyman and George for maybe 15 years. A funny story, I'm embarrassed to say, but it's true, is that when we wrote medical family therapy the first time, which is kind of a systems approach at that time in 90 to integrated care, I gave it to George Engel to read because I wanted his feedback and was also hoping he'd write a blurb for the back of the book. And he called me on Sunday afternoon, which is when he liked to talk to people. And I picked up the phone and he starts screaming. I'm like, oh my God, what did I do wrong? So we had called it Medical Family Therapy, a psychosocial approach to families with health problems. And he was out of his mind mad at me because I put psychosocial instead of biopsychosocial. And I said a few things like, well, George, you know, we don't really treat their hypertension, and we don't really, a few lame things. And he was like, I can't believe that that's what you think. And anyway, within about 3 minutes, I felt terrible. I thought, oh my God, we've been working on this for all these years. This is the whole point of what we do is integration, and look at the mistake we made. So anyway, that's how the subtitle got changed to biopsychosocial, and George wrote the blurb for the back of the book. So it takes a long time to really overcome cultural siloed healthcare in our own minds, as well as creating the financial and the administrative structures that support what we know can be good clinical care. So I spent a lot of time in the early years figuring out how to apply what psychosocial medicine family docs needed to know, working with Tom Campbell, and then got more interested in what the biopsychosocial model had to offer psychology and mental health. So I spent a amount of time doing that. Then I got interested in genetic disorders and spent some time on that. Most recently, I've been developed a physician communication coaching program. The dean asked me to do this for physician faculty med center-wide. So I've spent the last couple years doing communication coaching with the leadership and the chairs of the departments. And then I have 4, Colleen Fogarty, some of you may know these people, Colleen, Zipporah Rosenberg, Bill Watson, and Dave Seaburn are the other coaches that I trained in what I was doing. So we're spreading the gospel to other departments in that way. And I have, I guess the other thing to say is I have 2, besides the coaching program, 2 other leadership positions in the medical center. I'm a division chief in psychiatry of something called the Institute for the Family, and I am associate chair of family medicine. And I've been split 60% psychiatry, 40% family medicine since I started in 1980.
Very good. All right. Well, as I was saying earlier, we do have a few questions that people submitted. So let me jump into those here. Of course,
Sure.
This group is specifically about the PCBH model of integration. And so the first question is, what do you think of the PCBH model? And if you support the model, what would you do as APA president to help disseminate it?
obviously I support the model, or I hope it's obvious that I support the model. I think what we need to do at higher levels, besides making sure that there are opportunities to teach it earlier than at a post-degree level, is to work on financing and policy. There are a lot of financial barriers to not doing fee-for-service. And I hope as we move closer to population health and bundled care, that we'll be able to give patients the care that they need rather than the care that gets reimbursed, and be able to focus much more on prevention and brief intervention, which, you know, is what the behavioral health consultation model is all about.
Mm-hmm.
So
mm-hmm.
I think in terms of what APA can do, some of it is, I think, using the bully pulpit, being able to expose people to what it is and why it's so important and why we're able to affect so many people who wouldn't otherwise see a psychologist or behavioral health person,
mm-hmm.
and be able to promote their health, whether they have a chronic disease or they're 25 and healthy or whatever their situation is.
Mm-hmm.
And the other is to work with the policy people on making sure that as policies roll out about funding, that they're supportive rather than inconsistent with behavioral health consultation models. So, you know, places like the military, any place that has a kind of fully capitated situation, it's obviously the way to go, along with support of other services for patients that need more intensive care.
Mm-hmm.
But for places that don't have that kind of financial situation, I think that sometimes APA can really help with policy issues, mm-hmm. and with helping members understand what they need to do at the state level if it's a state issue.
Mm-hmm. Mm-hmm. Okay, we have two other questions that were submitted, and we got about 5 minutes here, probably. So, and we want to see
give so
other
I'll talk fast.
Folks a chance to ask questions if any come up. But so the next question is: the PCBH model is highly compatible with the triple aim goals of the Affordable Care Act. It also makes sense, just from the perspective that integrating BHCs in a primary care setting affords much greater access and opportunity to impact a much larger pool of people who could benefit from behavioral health interventions. Given this, as president of APA, how much emphasis will you be placing on training more psychologists to work in this environment, and how much assertive lobbying efforts will be made to CMA and private insurance carriers to expand the health and behavior codes and their fee structure for those codes?
So I think the first part of your question is what I was just talking about. You know, and I think some people are really far along, understand population health and how to think about it, but a lot of people aren't, no matter what discipline they're in. And so I think we really have to work on that. We have to work on expanding the number of, there's an internship, a bolus of money to apply for accredited internships to support people to get their internships accredited, and trying to move towards privileging those internships that have this training, I think is really important. We really need to be able to, once we convince people that this is the way to go, have well-trained people to give them when they want to hire. What was the second part? About lobbying. So there's a new Center for Psychology and Health. The director was just named. And I think it, along with other issues, which, you know, Randy Phelps has been involved in for a long time, and Suzanne Bennett-Johnson, Health and Behavior Codes. And I think it's going to, there's some indication right now, but it's really way too early to tell, that as they look for codes to describe what happens, and they're no longer tied to, you know, whether it's a mental health visit or it's a health visit, as if there was a difference, that they may really pick up health and behavior codes because they're already in the system. And it would be really good if they did that. They're, as you know, underfunded and underutilized right now, probably because they're underfunded. So I think, you know, it was a big victory to get them in, but we have a lot of ways to go before they're really useful. And as, you know, we just don't know whether our CPT codes are even going to be a relevant thing in 5 years.
Right.
Or whether they are going to want us to continue to describe what we're doing in that way. So I think we have to be prepared regardless and be creative about the behavioral health consultation model and other innovations as we figure out how best to care for a population of people and promote their health.
All right, very good. Last question that had been submitted in advance was, the APA consists of a diverse group of psychologists with varied clinical interests and practice settings. As APA president, how would you promote the PCBH model and population-based behavioral care in a way that promotes acceptance across the sub-disciplines of psychology? I'm specifically thinking of psychologists working in private practice or community mental health settings who see PCBH as a threat to their business model.
Right. So I'm talking to a lot of those people right now. And, you know, there's a subset of people who are just going to opt out. They tend to be older, and they're fine with being in a self-pay system. I think as we transition, you know, for the first several years, even while I was teaching in family medicine, I had an independent practice, but it was an independent practice that I spent a lot of time going to doctors' offices, seeing the first session with the physician, collaborating a whole bunch. I mean, I think there are transitional ways to help independent practitioners who are interested in becoming part of the new healthcare system. And, you know, they need CE on the behavioral health model. They need all kinds of, you know, we have to offer a lot of opportunities for training. I was just at the Georgia Psych Association and did a thing with Suzanne Bennett Johnson and Jennifer Kelly. And Jennifer's an independent practice with an anesthesiologist, and so they co-own this practice. And their way of doing business is creative. Her thing is pain, and so it's not primary care, but it is collaborative care. So I think that there's diverse clinical constituencies, there's diverse science constituencies. Everybody cares right now about health care. So my hope is to be able to enlist whatever their specific skills are to help us, you know, whether it's being a scientist or being a practitioner, being an educator, to help us really promote providing patients and families with comprehensive care. And one of the best ways to do that is the behavioral health consultation model. I'll let you know how that goes.
Right. You know, yeah. I mean, oftentimes the people who are the most difficult to have the most difficult time understanding immigration are our specialist colleagues. But
right.
Yeah. Well, let's open it up. I didn't see any questions that were typed into the chat box, but we have, looks like close to 30 people on the call here. So if any of you have a question that you would like to ask Dr. McDaniel, go ahead and unmute yourself and chime in here.
Or suggestions that you have for me, anything you want to say, I'm all ears.
Okay. Or maybe you've just done a great job of persuading everyone.
Well, but I think we're trying to go up against a dominant paradigm, so it's challenging I think people are interested enough that I'm obviously a serious candidate on the ballot, but how to bring them along and think this is the best thing for the organization.
Mm-hmm.
Challenge.
Mm-hmm.
Anybody
Hey,
have
Jeff.
ideas you'd like to share?
Jeff, this is Polly,
Yeah.
and I am making sure right now that everyone is unmuted so that if anyone who wants to ask a question, they're able to. But as I unmute all of you, if you don't, please go ahead and mute yourselves. Thanks.
Any questions, thoughts, suggestions from the audience? I want to make sure, too, that you get a chance to talk to us about what we can do to help your candidacy.
Oh, that would be great. I would love
So
that.
So if we'll give people another minute or so to think of a question. If people don't have one, that's fine, but we can just end it there. But if you could at least maybe talk for a minute or two about how we can help you.
So you can help a lot. APA has 90,000 people who can vote. 20,000 people usually vote. And I think people win because of a major grassroots campaign. And so I think email, developing long lists of every psychologist you ever knew in your entire life, and being willing to write them on my behalf. What would be ideal if you are willing to help is if you would email me. And so maybe, can you send out my email, Polly, to everybody on the SIG?
Yeah.
Great, thank you. And if you'd email me, just so that I can coordinate what you're doing, and what I'll do, besides you sending out something perhaps fairly soon, just saying, please look out for Susan's material in Monitor, and ooh, I'm getting a echo. And how much you think it's important and why you think it's important that I be the next president, that we focus on primary care and psychology's role in healthcare right now. And then I can send you material that you can personalize starting around mid-July, that you could send out to your network, your listservs, and also your individual emails. I think mean a lot because people then think you're really serious about it, but both of those things. So I would really appreciate your help. That is what makes the campaign, is people deciding they care enough that they're going to work for it.
Okay, we can certainly do that. And I've now run over our timeline about 3 times, but it did look like there was somebody who had a question. Robin, did you have a question? Robin raised her hand. If not, yep. Okay. Can you all hear me?
Yes.
Okay. So, all right. So I don't know if Robin had a question or not.
Oh, Jeff, it looks like she just put in a comment that says there are at least 27 of us here to vote for you.
Gotcha. Gotcha.
Thank you very much, Robin. I really appreciate your help.
Great. Okay. Well, we should probably wrap up, but I think you might be staying for the rest of the call anyway. But but thank you very much for your time, and
thank
hopefully
you all. I
things
really appreciate it.
Mm-hmm.
I'll mute myself unless there's something I just have to say.
Okay, sounds good. Okay, great. All right. Well, we can get into the regular items then for the meeting. So the first regular item is an update from the webinar work group. And Randy, I think I saw Randy's on the call, and you're going to be giving an update, right, on what's going on with that group?
Yes, I am.
All right. Take it away.
Okay. So as a group, we've been meeting and we've been discussing seminar topics that we'd like to start out with, and we are in the process of contacting potential presenters for those topics. We are also discussing presentation logistics, and we're shooting to start we're planning to launch the webinar series, the first series, in September, and then hopefully one time a month, both in October and November, and then possibly breaking in December. And lastly, we're learning more right now about CE qualifications and requirements so that we can incorporate that pertaining to the webinar. And that's pretty much it, and we'll have more info to provide at the next conference call.
Great. And we are, tell me if I'm wrong, but I think you're still interested in accepting new members if people want to get involved with that.
Yes. Mm-hmm.
We have down here that if people are interested in joining the work group, they can email you. Any questions or thoughts that that people have for Randy or for the webinar work group? And Polly, is everybody muted again now?
No, I've actually
sounds like everybody's probably.
Yeah, I've administratively taken almost everyone off. There's a few people that when I hear the feedback, I've put it back on, but it looks like almost everyone is off mute. So yeah.
Wow, it's a remarkably quiet group then.
It is.
That's impressive. All right. So, all right, so if people have thoughts, questions as we go along, just jump in then. So anything for Randy for the webinar work group? And if not, we can move along to, because Randy is also going to be doing the update for the next item. So what's going on with the social outing at the CFHA conference?
Yeah, so actually the social outing, I should have more info for the next call. What I hope to do is contact the members who've shown interest and possibly generate a survey to send out to the whole SIG group on preferences for what type of gathering everyone would like, and ideas are in progress. So I will have more info next time.
Great. And I think last time we did get a few people who joined you, right?
Yes. And I've had one more participant add since last time.
Great. And so this is another one that, you know, if people are interested in joining, helping out in any way, especially if you live in the DC area, then shoot Randy an email. But any other ideas or suggestions from the people on the call here about the social outing? Sounds like things are moving forward with it. And we talked about some specific ideas last time, just in terms of making it an evening event and things like that.
Yep.
Yeah. So, all right. Well, we can move on to the next item then, which is development of a PCBH toolkit for the CFHA website. And so David, I think, is on. Do you want to talk a bit, David, about that?
Absolutely. And can everybody hear me?
I can.
Okay, good. So the one thing that I want to say right off the bat that, we've had 2 people over the past week that said they have kind of emailed and said they were interested. If other people are interested, please email. Let us know. The more, the merrier for this, because we really want this to be kind of a fluid thing that we add topics and we develop, and it's continuous. So if there's other interested people out there, please let us know. We're currently developing and coming up with topics that we want to kind of cover over the next year and add to the website and the web page. What we've come up with now has been coming up with a list of research on the PCBH model, and like other organizations like ACBS has, trying to either have links or the PDFs of the research on the PCBH model so people can come and access those articles. It's just not a reference. It's actually the article or a link to the article and maybe a brief summary about that. So if people are doing lit reviews or anything like that, they can have access to those articles. Also developing a list of websites that have information about the PCBH model, and not just putting the website's link on there, but also having a little brief description so people actually know what they're connecting to. Trying to come up with a training resource as well, a potential list of books, video clips, graduate programs, internship, postdocs, people in the area that might be able to offer practicum rotations and this kind of thing. So just people that are interested in any training models or information they can have access to. Clinical interventions, worksheets, handouts, protocols, orientations such as MI, ACT that fit within this model of care. And then also we wanted to maybe come up with a section on different ways to intervene in primary care agencies. A lot of times we get kind of stuck on focusing on just the interventions, and we want to try to expand that to include other ways that we can impact primary care agencies. So if that's coming up with protocols or templates or other suggestions that other organizations have had to kind of have that in a centralized location so other people could come on here and say, oh, this is something that was neat. I would maybe like to try that in my organization, and just not have it be intervention specific, but have it related to just the primary care organization and helping primary care providers in general. And again, if anybody has any other interest, please email if they, even if you're not interested in being part of the committee, but if you have ideas of what the toolkit should contain or have, please let us know.
And David, that all sounds awesome. And we have down here, if interested in joining the toolkit work group, please email Robin. But I'm also wondering if we should just be giving out your email for this.
That's definitely fine. That's definitely fine. The past 2 people, I think they have emailed Robin, and then Robin just kind of CC'd everybody in the committee, and then we've updated them as we go along, which is what we're doing. So absolutely, people can email me or anybody else in the work group, but I'm fine having my email listed.
Yeah, might be easier for Robin. She already gets a fair amount of emails, I think. So, just go directly to you if you're okay with that. That'd be great.
Absolutely.
Yeah. So, thoughts, suggestions, ideas for the toolkit group right now? Anything come to mind for folks? Got a lot of things that you're working on there.
Well, we're trying. We're trying. We're going to have to start divvying up the responsibilities soon. So that's where, if people are interested, please email, because we'll definitely be divvying up the workload over the next couple of weeks. So it would be great to have a lot of people.
Okay.
What's your email, Dave?
My email is D as in David, Bauman, B-A-U-M-A-N, at Forest, F-O-R-E-S-T.edu.
And if you're okay with it, I've also included it in our minutes for today's meeting, which will be distributed just to our SIG members.
Perfect.
Great.
Thanks.
Yep.
Okay. On to the next one then. Development of a frequently asked questions page for the CFHA website regarding PCBH. So kind of a section that would list common questions and answers to those regarding PCBH specifically. And so Suzanne, I believe, is on the call too and is chairing that work group. You want to give an update on what you guys are doing?
I think she might be having technical difficulties. This is Robin. I'm going to try to pinch hit unless she chimes in a second here.
Can you, Suzanne, can you?
Yeah, Jeff, this is Polly. She's been messaging. She's kind of in and out of connectivity. So it may be best at this point if we have Robin report out if she can.
Okay.
So the FAQ work group met with the SIG leadership just to kind of plan things out and organize what they were going to do. And I think I think they're working on generating FAQ questions as well as the answers for that. They're going to be reaching out to the larger SIG membership to ask for ideas of what people would like to see on the FAQ page. So you can watch the listserv for solicitation for that. They're going to be looking at, other websites and other related organizations' materials to see what kind of topics are popular and should be included. They have a whole host of ideas of topics that they're researching right now, and it should be very useful once they get that together. So I think it's in progress. I'm sure they'd be happy to have other members to help them as well. And you can email me for now, or maybe we can get Suzanne's email on there so that other people can join. And they're going to try to have a living document, I think just like the toolkit, where this is continuously updated and will be current. So it should be very useful. And the group is going to meet every other month right now and work on things, and then they might meet a little more often if they need to, but I think they have laid out a plan at their recent meeting.
Mm-hmm. Yeah, all the work groups have just been really doing a great job, I think, of really getting a lot of ideas going and getting things moving. So it's great. And any questions about what's going on with FAQ group or suggestions? And then if people do want to join, should they still email you, Robin, if they're interested in joining that group?
Yeah, I think that's fine, and I'll just pass it along.
Okay. Okay. Can't very well volunteer Suzanne's email if she can't chime in. I guess that wouldn't be fair. So, okay, great. So next item then was just kind of some open discussion items. We had started talking last time about outreach issues, branding issues, and there were lots of ideas that got floated last time, like maybe we would have a unique ribbon at the conference that would identify us as a CFHA SIG member. Maybe we would have a pin that we could wear that would say, ask me about PCBH. We talked about having T-shirts that for the SIG. Lots of ideas. We talked a little bit about how to move forward on these different ideas. Should we have another work group, or and maybe the work group would be sort of broader even than just branding, talking about outreach issues in terms of outreach to other organizations, things like that. So I don't know. Any more thoughts on this topic? I mean, either other ideas about branding or connecting with other organizations, or opinions about whether we should have a work group on this or not. I personally kind of like the idea of having a work group because I think things get done. It seems like when we do that, but you know, I don't know if anybody's particularly interested in that.
So Jeff, Robin Lute says she thinks we should have a work group. And I'm not sure, I think Robin's unmuted from my perspective, but I think she's having a hard time unmuting.
Oh, okay. Looks like there are a number of people that have that yellow triangle with the exclamation point in the middle. Does that mean they have connection problems?
No, I don't think so.
Oh, okay.
We're on the work group. We're on the branding one, or the
Right.
Yeah.
Branding. Yeah. Yeah. So.
What was the thinking behind this?
Well, the idea was to just to help with sort of outreach and dissemination and so forth. And it's helpful to have branding. You know, for example, maybe we would have identifiers in some way. You know, that at the conference, at the CFHA conference, that would be unique to us, or you know, maybe we would have on, you know, presentations related to PCBH, we'd have like standard slide formats, or, you know, things like that.
Mm-hmm.
So, well, why don't, is anybody else particularly, yeah, I mean, if Robin is interested in having a work group, and if she can't speak up for herself, then that means I could probably volunteer her to chair it. But
yeah. So Jeff, Robin typed in that Robin Lute typed in that she would be willing to help.
Great.
She can volunteer to coordinate, but she's not creative per se.
Okay. And for the record, I was just joking about volunteering you, Robin, but if you really are interested in doing this and trying to organize a work group around it, I think it would be great. I mean, there are lots of different directions we could go with this. And I'm certainly happy to help out too. Well, why don't we do that? I mean, I don't see a good reason not to, so why don't we do that? Let's plan on just kind of forming a work group to talk more about this. Any other ideas come to mind about on this topic about branding or outreach that would be good for us to be thinking about?
Hey, Jeff.
Mm-hmm.
This is Robin Lute. Can you hear me?
Oh, yeah, we can hear you now.
Okay. I wasn't necessarily trying to I'm unmuted now. I was just typing my comments. I'm sorry. Yeah,
no
I can volunteer to coordinate the group, especially if somebody else is interested in it. I think it is an important idea to make ourselves stand out in some way and be like an integrated effort within ourselves, and you know, sort of make a presence and try to get some advertising or marketing that you know, to ask about integrated care or whatever that case may be. I'm not necessarily the most artistically or otherwise creatively inclined person, so while I can coordinate and ask for participation and that sort of thing, it's not like I'm going to be designing some fantastic logo here.
Okay, so noted.
Personally.
Well, me either, but hopefully we could get some other people who are more creative on the on the work group. So
Jeff, are you guys thinking in terms of outreach and branding, are you thinking of that at the CFHA conference or outside in like your own, you know, in your own communities of, and where, like, who's your target with that?
Well, I think probably the branding part is more within CFHA, helping to you know, just create sort of a recognized product within CFHA. But we had also talked about how do we reach out to other organizations, other than CFHA. How do we get our members to connect with them in one way or another, collaborate on projects, things like that. Communicate about who's also, what other conferences would be good for us to present at about PCBH and so forth. So, so that was one of the ideas too.
Good.
But I suspect that we just have to talk it through once we get a work group going, and then we can talk more at the next meeting about ideas.
Sounds good. And we're happy to help from a conference perspective too. If you all would like for your membership specific, maybe a way on your name tags to identify you all as PCBH SIG members or something, we can do that. And I think somebody, Suzanne Dobb, actually typed in a suggestion that we have a conference booth for you guys, and we can certainly set that up if you all are interested in doing that.
Okay. Great. Yeah, that's a great idea. So we've got a couple ideas to start with. Then we'll form a work group. Robin will take that on to help organize that, and if anybody's interested in joining that group with us, then I'm going to suggest that you email Robin Fielder, our co-secretary. Her email address is above in the agenda there on the other items, and we'll try to set up a meeting of interested people over the next month. So great. All right. So next item then is research on the PCBH model. And so this is just a chance for members who are engaged in research or to talk about what they're doing, or if you're looking for other people to collaborate with, to throw that out there. So anything people want to mention?
This is David Bauman again, and I would just want to make a call. We did this, I think, the first or second phone call that we talked about the project that we're doing currently right now, where we're asking medical providers to fill out a couple of screeners regarding the psychological flexibility, which is a acceptance and commitment therapy kind of philosophy, and then also looking at their stress levels. And we found some interesting kind of connections between the two. So we're trying to expand that and get a bigger sample size. So we have had a couple of medical centers that were interested, and we've done the survey with them. But if anybody else is interested in having their medical center do it, we also have included a primary a behavioral health satisfaction part to the survey as well. And in total, it takes about 10 minutes for providers to fill out. But there's a lot of good data that can be used for your own individual clinic, and then we're going to try to use the data as well just to get some psychometrics and then look at just how much variance is contributed to stress that the psychological flexibility takes up. So if interested, you can email me again at dbauman@forest.edu. Bridget Beachy is part of the project as well, and her email is bbeachy@forest.edu, and then Melissa Baker at mbaker@healthpointchc.org, if anybody's interested in that.
And we'll put all those emails in the meeting minutes too.
Perfect.
I missed the second one. Can you repeat that for me?
The second one?
Yeah, the Beecher.
Yeah, Beachy, B-E-A-C-H-Y, so it would be bbeachy@forest.edu.
Okay, and then the other was mbaker@healthpointchc.
Yes, .org.
.org. Is that HealthPoint with an E or without?
Without an E.
Okay, thanks.
Yep.
Anything else as far as research that's going on or collaboration opportunities? Jennifer Funderburk is, I believe, on here, right? And Jennifer, did you want to say something about the CFHA Research and Evaluation Committee?
Hello, am I on?
You are.
Oh, yes, I figured it out. Yes, I would. I would love to share about the research committee. I am basically looking for or sharing the fact that the research committee meets on a monthly basis, and we are looking for people to participate in our phone calls and discussions about how to move forward CFHA's commitment towards research, program evaluation, and quality improvement on integrated healthcare. And I thought I would present about it in this forum just because I know that there are people on the call who have mentioned some projects that sound like they would fall in that realm and may be interested in participating in this group. Our committee has lots of goals, and I can't see on the agenda if because it's not down that far, but there is a website for the committee where you can look at our charter and focus in on the goals itself. But basically what we're involved in is several things. We participate in the abstract review process for the conference. We are also in charge of the fellowship application process, as well as choosing the fellowship awardee. And then we are also involved in lots of things to help educate the membership about either current research on integrated healthcare, and that includes program evaluation and quality improvement efforts as well as educating the membership, those who may not be as savvy on those topic areas, to help increase their willingness to participate in those efforts, even if it's on a very small basis, like within their own practices. As you know, the only way that a stronger evidence base is going to be established is if all of us in all of our roles participate in doing so. So we just wanted to open the door for people to participate in our calls. You don't have to be a regular attendee. You can come on anytime you want, and if you're interested, I guess you could let Robin Fielder know, and she can give me your email, and I will put you on the email, on the emails where you get the telephone number to participate. So, does anyone have any questions?
When did that start up, Jennifer?
Our next call, and looking at my calendar right now, is June, the first Thursday in June, so June 5th.
And when did that whole committee start up?
It's been in existence for several years. The difference is that with the change in, just recently have we opened the doors to non-voting members as well as non-CFHA members. So anyone can participate in our calls and kind of participate in the discussions as far as where our committee goes in the future. Only certain members are voting members, and those have to be CFHA members to be a voting member. They're the ones who are responsible for directing, I guess, finalizing our commitments. But I would say that right now, I mean, everyone actively participates in helping figure out where our committee goes next. And now's the best time to participate because we're brainstorming ideas on where the committee, what we're going to do in the next year and what our objectives are. So
great.
If you have a passion about this topic area, whether it's be quality improvement, program evaluation, and feel like you'd like to promote that more, this is the committee for you. All
right. Very good. Well, thank you very much, and that's going to about wrap it up for us here. The recording of this meeting will be available. You got the link there. We'll let you know when it's available. The next meeting is going to be Wednesday, June 4th. So get it on your calendars, and thanks very much to everybody for participating. Talk to everybody next month.